And welcome back. Thom Hartmann here with you. You know, the Republicans on Capitol Hill, actually Republicans everywhere, say we're all about cutting the national debt and slashing the outrageous levels of government spending. The best way to fix the country's economy is austerity. We can cut our way to prosperity. No other country's ever done it before in the history of the United States, but we can do it. Nah. When Paul Ryan and his buddies talk about slashing government spending, what they're really saying is they don't want government money going to working class or poor Americans. They got no problem at all when that government spending is going to their millionaire and billionaire buddies who run America's giant health insurance corporations. And in the process of handing over money to corporate executives, Republicans are costing American taxpayers and the economy trillions of dollars. For example, if the Republicans hadn't fought President Obama over a public option or even a single-payer system under Obamacare, and we had followed the path of Medicare's rollout in 1966, which the Republicans didn't like, but they didn't lay down in the street. They didn't vote over and over and over and over and over again in the House of Representatives to repeal. They just said, okay, you guys win. If we had followed the path of Medicare's rollout in 66, we would have saved billions of dollars. PNHP.org, Physicians for National Health Program, did a study on this, and what they found, these researchers at the City University of New York, that's CUNY, isn't it? Is that how they say it? CUNY? That when all is said and done, the costs of getting Obamacare up and running and enrolling 7 million Americans in the program in the first year are going to total about $6 billion. So that's about roughly $90 a person. You compare that to the cost of Medicare's rollout back in 1966. According to the CUNY researchers, Medicare's costs in the first year totaled $867 million in today's dollars. That's roughly $5.1 billion less than what Obamacare is costing in its first year. And within 11 months of LBJ signing Medicare into law, 19 million people, senior citizens, had signed up for it. That's 99% of everybody who was eligible. So why was the 1966 Medicare rollout so cheap compared to the Obamacare rollout? It was cheaper because back then Republicans weren't shilling for their billionaire friends in the health industry by opposing a single-payer system or a public option. Because Medicare is single-payer. Dr. David Himmelstein, one of the CUNY researchers, put it, the simple single-payer Medicare for all approach would save more than $400 billion annually on bureaucracy, enough to give every American first-dollar coverage. But to get those savings, you have to break private insurers' stranglehold on health care and on Washington. He added, Obamacare is a giant workaround crafted to keep private insurers at the center of the healthcare system. So, simply put, a single-payer healthcare system which excludes billionaire private insurers and the influences they have over Republicans in Washington could save our country billions of dollars. And we don't have it. That's the bad news. Now, here's the good news. There's a backdoor built into Obamacare, which lets the individual states create their own single-payer healthcare system starting in 2016. And at least one state has already jumped on board. Back in 2011, the Vermont state government enacted a law creating the nation's first state-level single-payer healthcare system. It's called Green Mountain Care. Kaiser Family Foundation describes Green Mountain Care as a state-funded and managed insurance pool that would provide near-universal coverage to residents with the expectation that it would reduce healthcare spending. In a blog post for the Huffington Post, Vermont Governor Peter Shumlin, who has been on this program and talked about this, said that Green Mountain Care is a single-payer system that will control healthcare costs, not just by cutting fees to doctors and hospitals, but by fundamentally changing the state's healthcare system. Seeing the support that a single-payer healthcare system has gained in Vermont, other states are beginning to follow suit. Right now, lawmakers in Montana are working hard to establish a single-payer system in that state. Slowly but surely, more and more states are going to realize the overwhelming benefits of a single-payer healthcare system. Like mostly, it cuts your costs in half. And once that happens, we can expect to see the Canadian experience all over again. You know, in Canada, they did this in Saskatchewan, and it worked so well that every other province said, hey, we want that. So I think it's quite possible that by 2020, we're going to have a system of state-run single-payer systems here in the United States, just like there is province by province in Canada, overseen by the federal government. Here's the sad part of this. This should have happened years ago. I mean, we should have done this. We could have done this before Canada did. But, Republican obstructionism, we've had to spend years getting to a rational and cost-effective healthcare system, and we're not even there yet, when it could have been done 69 years ago, when President Harry Truman first proposed the legislation back in November of 1945. That was when we first proposed single-payer legislation. Over the past 69 years, people have been dying and going bankrupt for lack of health care because of the Republican commitment to their health care billionaires. Now, Obamacare is a start, but it's only a piece of the puzzle. America needs a single-payer health care system, and we need it now. Congressman John Conyers has once again introduced House Resolution 676, the United States National Health Care Act, which calls for the creation of a single-payer health care system here in the United States. We could do this. Make single-payer health care system a reality in America.